Imagine being 65, 70, or even 80 years old and growing brand new teeth. Not dentures, not implants. Real, natural teeth that grow from your own jaw, just like when you were a child. This isn't science fiction anymore. Japanese researchers have just made a groundbreaking discovery that could change dentistry forever. They've identified a protein that, when blocked, triggers your body to grow completely new teeth from dormant tooth buds that have been sleeping in your jaw for decades. If you're over 60 and struggling with missing teeth, dentures, or expensive implants, what I'm about to share could give you hope for a future you never thought possible. Section 1. The discovery. This breakthrough comes from Kyoto University and the Research Institute for Microbial Diseases in Japan. The lead researcher, Dr. Katsu Takahashi, has spent over 15 years studying a specific protein called USAG1. Here is what they discovered. Humans are actually born with a genetic ability to grow 3 sets of teeth, not just 2. We all know about baby teeth and adult teeth, but there's a 3rd set of tooth buds hidden in our jaws that never develop. They remain dormant our entire lives. Why don't these teeth grow? Because the USAG1 protein actively suppresses them. It's like a lock that keeps these dormant tooth buds from activating. Dr. Takahashi's team created an antibody drug that blocks USAG1, essentially unlocking these sleeping tooth buds. In animal trials, the results were extraordinary. Mice and ferrets with missing teeth grew completely new, fully functional teeth after receiving the antibody treatment. The teeth had proper roots, enamel, and even connected to nerves and blood vessels, just like natural teeth. According to the research published in Science Advances, this isn't regenerating damaged teeth. This is activating an entirely new generation of teeth that nature gave us but never let us use. Section 2. How it works. Let me explain how this works in simple terms. Your jaw contains something called tooth germs or tooth buds. These are primitive cells capable of developing into complete teeth. You had active tooth germs when you were a baby that became your baby teeth. You had another set that became your adult teeth. But you also have a 3rd set that never activated. The USAG1 protein is part of your body's regulatory system. It prevents excessive tooth growth, which sounds helpful, but it also prevents that 3rd set from ever developing. Evolution kept this protein active to avoid overcrowding in our mouths. The Japanese antibody drug works by binding to USAG-1 and neutralizing it. Once USAG1 is blocked, molecular signals called BMP and WNT pathways activate. These are the same pathways that created your teeth when you were young. The dormant tooth buds receive the signal to grow, and they begin developing into complete teeth. The process takes months, similar to how long it took your adult teeth to come in when you were a child. But the result is a real tooth with roots, nerves, and all the characteristics of natural teeth. Get your copy of The Ultimate Guide to Transforming Your Life After 60, packed with proven tips, expert insights, and powerful habits to help you feel youthful and vibrant again. Plus, enjoy a bundle of exclusive free gifts included with your purchase. Click the link below to claim yours now. Section 3. Current status and timeline. Now, I need to be very clear about where this research currently stands. Human clinical trials began in 2024 at Kyoto University Hospital. The first phase is focusing on safety, testing the antibody drug on adults who were born with congenital tooth agenesis. That means people who were born missing certain adult teeth due to genetic conditions. If these Phase 1 trials show the drug is safe and effective, Phase 2 trials will expand to include people who lost teeth due to cavities, gum disease, or injury. This is the group that includes most seniors. According to Dr. Takahashi's published timeline, if everything goes perfectly, this treatment could be available for practical use by 2030. That's approximately 6 years away. But here's what's realistic. Dental and medical innovations often take longer than expected. Regulatory approval, especially for something this revolutionary, requires extensive testing. We're likely looking at 2030 to 2035 for widespread availability, and initially, it will probably be expensive and limited to specialized dental centers. The good news is that the research is progressing faster than similar regenerative medicine projects, because the mechanism is relatively straightforward. It's not growing teeth from stem cells or complex tissue engineering. It's simply unlocking what's already there. Section 4. What this means for seniors. So what does this mean for you if you're over 60 right now? First, this offers genuine hope for a future without dentures or implants. Imagine being able to eat whatever you want, smile with confidence, and never worry about denture adhesive or implant failures again. Second, this could dramatically improve quality of life. Missing teeth aren't just cosmetic. They affect your nutrition because you can't chew properly. They affect your speech. They even affect your facial structure as your jawbone deteriorates without tooth roots to support it. Natural teeth grown from your own body would integrate perfectly with your jawbone, preventing that bone loss. They would have natural sensitivity, allowing you to taste food properly and avoid biting too hard. Third, the long-term health implications are significant. Poor dental health is linked to heart disease, diabetes complications, dementia, and even shorter lifespan. Having functional natural teeth in your later years could add healthy years to your life. Now, the challenges we need to acknowledge. This treatment will likely be expensive initially, possibly tens of thousands of dollars per tooth. Insurance coverage will take years to negotiate, and we don't yet know if older adults will respond as well as younger patients. Age-related factors like reduced cell regeneration capacity might affect results. But even with these uncertainties, this represents the most promising dental breakthrough in modern medicine. Section 5. What you can do now, while we wait for this treatment to become available, here's what you should do. Preserve your existing teeth aggressively. Every natural tooth you save now is one less tooth you'll need to regrow later. That means excellent oral hygiene, regular dental checkups, and addressing problems immediately before they require extraction. Maintain your jawbone health. If you have missing teeth, consider implants now if you can afford them. Implants prevent bone loss and keep your jaw structure healthy, which will be important if you eventually want to grow new teeth in those spaces. Stay informed about the research. Follow updates from Kyoto University and Dr. Takahashi's team. When human trials expand, there may be opportunities to participate, especially if you have specific dental conditions. Take care of your overall health. This treatment will work best in people with good general health. Control your blood sugar if you're diabetic, don't smoke, eat a nutrient-rich diet, and maintain good circulation. Your body needs to be in optimal condition to grow new teeth. Consider dental tourism in the future. Get your copy of The Ultimate Guide to Transforming Your Life After 60, packed with proven tips, expert insights, and powerful habits to help you feel youthful and vibrant again. Plus, enjoy a bundle of exclusive free gifts included with your purchase. Click the link below to claim yours now. If this treatment becomes available in Japan or other countries before it's approved in the United States, medical tourism might be an option for those who can travel. This Japanese research represents something truly revolutionary. For the first time in human history, we're not just replacing missing teeth with artificial substitutes. We're preparing to unlock a biological capability that's been inside us all along. Will it be perfect? Probably not immediately. Will it be expensive? Almost certainly at first. Will it work for everyone? We'll have to wait for the trial results to know for sure. But the fact that we're even having this conversation, that growing new teeth as an adult is moving from impossible to probable, is absolutely remarkable. If you're 60, 70, or even 80 years old, there's a very real possibility that within the next decade, you could grow brand new natural teeth. That's not a fantasy. That's science in progress. In the meantime, treasure the teeth you have. Take care of them like they're irreplaceable, because right now, they still are. But the future is coming, and it's bringing possibilities our grandparents never could have imagined. If this video gave you hope for the future of dental health, please hit that like button and subscribe to our channel. We'll keep you updated as this research progresses. Drop a comment and let me know. Would you try this treatment when it becomes available? Stay healthy, stay hopeful, and remember, the best is yet to come.